Usually when we talk about getting a medical diagnosis, there's this underlying expectation of just like absolute precision.
Oh, totally. It's supposed to be black and white.
Right. You break your arm, the x-ray shows that jagged white line, and the doctor just points to the screen. It's binary. Broken or not broken.
Yeah, and it's comforting, honestly, in a weird way.
It really is.
I mean, even if the news is bad, the clarity is absolute. You know exactly what you're dealing with, right? And what the next step is. But the moment you step into the world of genetics or, preventative health, that clarity just completely vanishes.
Yeah, it's like the x-ray machine is broken. You're suddenly dealing with probabilities and percentages, statistical risks.
Muddy waters.
Exactly. And let's be honest, for the listener, that is the exact cocktail of ambiguity that sends the human brain into an absolute spiral of anxiety.
Oh, 100%. It is the literal definition of diagnostic muddy waters. When you look at a list of things you, or maybe a loved one, might be predisposed to, the biological instinct is to just immediately assume the worst-case scenario.
Like it's already happening.
Yes, like it's already a done deal.
Okay, let's unpack this. Because we are looking at a highly specialized veterinary dossier today, and it's focused entirely on the genetic health of Border Collies.
Which is such a specific niche, I know.
It is. But wait, if you don't own a herding dog, do not skip this.
Yes,
because what we're actually extracting from this data today is it's basically a masterclass on how to think about genetic health predispositions.
It's a universal blueprint, really.
Yeah, it's this brilliant, highly adaptable framework for you to manage complex health data without panicking.
And to use that framework, we first have to, fully embrace the core philosophy that's driving these veterinary specialists, which is simply knowledge does not equal worry.
Say that again because that's huge.
Knowledge does not equal worry. When you start exploring genetic data, the whole objective is to become a proactive partner in long-term health.
Right.
You have to actively shift your posture, away from defensive anxiety and toward empowered preparation.
And that shift requires us to completely redefine the word predisposition. Because, when most of us hear that we or our dogs are predisposed to a condition, it sounds like a ticking time bomb.
Yeah, it feels like a guarantee.
Exactly.
Which is easily the biggest misconception in genetics.
Really, the biggest.
Oh, by far. A predisposition simply means an increased statistical risk within a specific population. That is all it is.
Just a statistic.
Right. It does not mean inevitability for the individual. Biology rarely offers absolute guarantees anyway.
Sure.
So having the genetic markers for a condition, it doesn't mean that condition will ever actually manifest.
I like to think of it like a car recall.
Oh, I love this analogy.
Right. So let's say you drive a specific make and model of a car, and the manufacturer announces, hey, there's a known documented issue with the alternator.
Right. They send you the letter in the mail.
Exactly. Now, knowing that fact doesn't mean your specific car sitting in your driveway right now is going to stall out on the highway tomorrow.
No, of course not.
But it does change your behavior. It means that when you take the car to the mechanic for, a routine tune-up, you explicitly ask them to check the alternator.
You're paying attention to it.
Right. You keep an ear out for a specific rattle under the hood. It shifts you from being this anxious driver just waiting for an explosion to an empowered owner who actually knows the maintenance schedule.
Yeah, and what's fascinating here is how this mental shift directly dictates your actions. Why does redefining predisposition matter in practice?
Why?
Because it shapes exactly what you discuss with a medical professional. It helps you categorize which minor symptoms you decide to take seriously, rather than just dismissing them as fatigue.
That makes so much sense.
You're no longer flying blind. You have a roadmap.
So, if we have this roadmap, the first massive hazard it points out for these highly active dogs involves their physical foundation.
Yes, the structure.
We're talking about bones and joint.
Right. Orthopedic conditions are incredibly prevalent in the data for active breeds. The two major ones you really need to understand are hip dysplasia and osteochondritis discans.
Which people usually just call OCD, right?
Exactly, OCD.
Okay, but wait, I am a bit confused here. Border Collies are herding dogs.
They are.
They're bred to be like elite athletes that run all day and turn on a dime. Why are their joints suddenly so fragile?
Well, that is the crucial question, isn't it? And it perfectly highlights the intersection of genetics and environment.
Okay.
Conditions like hip dysplasia are not just about the raw DNA the dog is born with. It's about how those genes interact with the physical environment during really critical developmental windows.
Can you explain what hip dysplasia actually is, though? Because I hear it all the time. Are we just talking about early onset arthritis?
Not exactly. I mean, it is fundamentally a structural failure. So, a healthy hip joint is supposed to be this smooth ball and socket,
Right.
and they glide together perfectly. But in a dysplastic dog, that joint doesn't form or fit correctly. There's this looseness or instability.
Well, that sounds painful.
It is. And over time, that poor fit causes abnormal wear and tear, which degrades the joint and then eventually leads to arthritis.
Got it. And what about the OCD one?
OCD is a bit different. It involves abnormal cartilage development, usually in the shoulder, and it typically shows up during the growth period of really young, active dogs.
So if the hip joint structurally doesn't fit together,
Mm.
isn't that just baked into the dog's DNA from birth? Like, where does the environment even come in?
The danger lies in overloading a growing puppy's joints.
Overloading them.
Yeah. A puppy's skeleton takes a surprisingly long time to fully solidify. If a dog has an underlying genetic predisposition for joint instability, and you're taking that puppy on these massive miles-long runs,
Oh, I see.
or, having them do repetitive high-impact jumping before their growth plates have even closed, that intense environmental stress can trigger or just severely worsen the condition.
Ah, okay. So the dog might carry the genetic risk, but if you treat their growing joints with extreme care, you might avoid triggering the worst of it.
Exactly.
It's about protecting the system while it's still under construction.
That's a great way to put it. If you know the predisposition exists, you manage the puppy's environment completely differently. You take a highly cautious approach to exercise during that one specific growth window.
It makes total sense that we can control joint issues by, managing physical exercise. But what about conditions where the environment doesn't really matter?
Right, the inevitabilities.
Yeah, where it's purely a matter of biology just revealing itself over time.
That brings us to sensory systems, specifically inherited eye conditions. And this is where the element of time completely changes our diagnostic approach.
Okay, let's get into the eyes.
The data highlights two distinct conditions here: Collie Eye Anomaly, or CEA, and progressive retinal atrophy, PRA.
Here's where it gets really interesting for you listening,
Yeah.
because these two eye conditions operate on completely different timelines.
They do?
CEA is congenital, meaning it's present the moment the puppy is born.
Yes. It affects the development of the structures at the back of the eye, specifically a layer called the choroid.
The choroid. What is that actually doing in the eye?
Think of it as the vital vascular layer. It's what supplies oxygen and nutrients to the retina.
Oh, wow. Okay, so it's super important.
Very. And in CEA, that layer just doesn't develop fully. Now, this is a spectrum disorder.
Meaning it varies in severity.
Exactly. It can range from having almost no noticeable impact on the dog's vision at all to causing significant visual impairment or even blindness.
It's a huge range.
It is. But the key takeaway is that because it's a developmental flaw present at birth, a certified veterinary ophthalmologist can screen a whole litter of young puppies and identify the anomaly before the owner ever even notices a problem.
That's amazing. You can know the genetic status before you even bring the puppy home.
Exactly.
But PRA is a totally different beast because, well, progressive is right there in the name.
Right. PRA involves the gradual degeneration of the retina over the course of the dog's entire life.
So they aren't born blind.
No, not at all. A puppy with PRA will likely pass an eye exam with flying colors. The retina works perfectly early on.
Wow. So you can't just rely on a clean bill of health at 8 weeks old and assume you're in the clear forever.
No, you really can't.
This puts a massive amount of responsibility on the owner, to stay vigilant as the dog ages.
It demands lifelong observation. Because the physical structure of the eye looks completely fine early on, your primary diagnostic tool actually becomes the dog's behavior.
Their behavior.
Yeah, you have to watch for subtle clues that their sensory experience of the world is shifting.
The behavioral changes in the dossier were fascinating. It's things like an adult dog suddenly bumping into a coffee table they've walked past for 5 years.
Yes, or they start hesitating at the top of the stairs when the hallway lighting is dim.
Right. It just proves why preventative care isn't a one-and-done event.
It evolves. And informed ownership means staying attuned to those really subtle shifts.
Okay, so we've looked at physical structure, and we've looked at the senses, but there's a category of genetic risk that feels much more unpredictable.
Oh, definitely.
Where the internal wiring of the dog suddenly just short circuits.
We're talking about neurological and systemic conditions. And these are jarring because they can violently disrupt a seemingly healthy dog's life without any prior warning whatsoever.
Yeah, idiopathic epilepsy is one of the most prominent issues discussed here.
It is.
And seeing your dog have a seizure has to be terrifying. I mean, it's usually a combination of involuntary muscle movements,
Mm-hmm.
a sudden loss of normal awareness, and a really heavy period of disorientation afterward.
It's awful to witness.
Yeah.
And idiopathic simply means that these recurrent seizures happen without any identifiable underlying cause.
Like no brain tumor.
Right. No brain tumor, no ingested toxin. The seizures just happen. And it has a heavily recognized genetic component in herding breeds.
Wow.
The absolute mandate here is that a seizure is never a wait-and-see situation. Any neurological event requires immediate veterinary intervention.
There is another sudden onset condition in the data that honestly surprised me. Exercise-induced collapse, or EIC.
Yeah, EIC.
You picture a working dog in peak physical condition running hard, and suddenly their back legs just wobble and give out entirely.
It's observed across several herding breeds, actually. Following intense exercise or even just really high excitement, the dog experiences profound weakness or a full collapse.
That's so scary.
It is. And the crucial takeaway is that if an owner sees that unusual weakness during vigorous activity, the mandate is to stop all activity immediately and consult a vet.
You never assume the dog is just tired and try to push them through it.
Never.
Okay, I really want to dig into the MDR1 gene mutation, because this challenges the whole way we think about genetic diseases.
It really does.
Having this mutation doesn't mean the dog is actually sick.
Not at all. It's a genetic mutation affecting a specific protein that regulates how substances move across barriers in the body. Most importantly, it regulates the blood-brain barrier.
Okay, so to create a bit of a visual for you,
Yeah.
it is basically a biological bouncer standing at the door to the brain.
I love that. Yeah.
Right. In a dog without the mutation, the bouncer checks the ID of every chemical circulating in the blood and keeps the dangerous neurotoxins out of the VIP section.
Exactly.
But with the MDR1 mutation, that bouncer is asleep on the job.
That is exactly the mechanism. Because that regulatory barrier fails, certain everyday medications slip right past the barrier and into the brain.
Just waltz right in.
Yep. The dog has a severe, sometimes fatal sensitivity to highly common drugs. We're talking about certain anesthetics and even standard antiparasitics.
Which means there is no treatment for this. You don't give the dog a pill to wake the bouncer up.
No, you can't fix the bouncer. But if we connect this to the bigger picture, testing for the MDR1 mutation is the ultimate example of preventative information management.
Right.
You get the genetic test and you put that data on file. It dictates every single medication decision the vet will make for the entire life of that animal.
Wow.
It is pure, actionable data preventing a future crisis.
We have talked so much about genetics, but active dogs are basically like human athletes.
They really are.
Sometimes they just get hurt doing what they do, completely independent of their DNA.
Yeah, just non-hereditary wear and tear. Dogs that do a lot of running, jumping, quick directional changes like agility dogs or working farm dogs, they are highly prone to soft tissue strains.
Makes sense.
The shoulder is a common problem area, along with the iliopsoas muscle group.
The iliopsoas. What exactly is that doing for the dog?
It's essentially the core hip flexor muscle. It connects the lower spine and pelvis to the femur. It powers the dog's forward drive and jumping ability.
Oh, so that is a lot of heavy lifting.
Massive amount. When a dog turns on a dime chasing a ball, that muscle absorbs an incredible amount of torque.
And then you have cruciate ligament injuries in the knee.
Right.
That can happen from a sudden trauma-like, a terrible landing while catching a frisbee, or just gradual degeneration over time. But the overarching rule the experts push is, if there's a sudden limp or a reluctance to bear weight, do not just enforce bed rest and hope it goes away.
Please don't. Early intervention prevents compensatory injuries.
Compensatory injury.
Yeah, so if a dog's knee hurts, they shift their weight to avoid the pain, and suddenly they've severely strained their opposite shoulder.
Oh, man. A domino effect. To avoid all of this, or at least minimize the risk right from the start, the data heavily points to the role of the breeder. Transparency seems to be everything.
Finding a breeder who performs appropriate health screening is the single most impactful preventative step you can take.
By far.
They should be providing evaluations of the parent's hips, eye exams from certified veterinary ophthalmologists, and genetic testing for things like CEA and MDR1.
Now, testing the parents doesn't mean the puppy is invincible, right?
No. But it meaningfully reduces your statistical risk.
They also highlight a practical tool called Vital Pet for managing all this.
Yes, that's a great resource.
It doesn't diagnose or treat anything. It just acts as a central digital hub, for these screenings, test results, and medication histories.
Which is so crucial.
Because if you have an emergency at 2 a.m., you need that MDR1 data immediately available to whoever is treating your dog.
Exactly. It comes back to being a proactive partner. Whether you're tracking an MDR1 test or catching a minor limp early, highly organized data consistently leads to better outcomes.
So what does this all mean? When we zoom out from hip joints, eye anomalies, and biological bouncers at the brain, the ultimate takeaway is that this information is just a map.
A very detailed map.
Right. A list of genetic predispositions isn't a list of inevitable tragedies. Knowing the terrain ahead of time means you are never caught off guard. You know exactly what questions to ask your vet, and you can practice truly informed preventative care.
And I want to leave you with a thought to mull over, building directly on this philosophy.
Okay.
Right now, human genetic testing is incredibly common. People mail off a DNA swab and receive pages of data about their own genetic predisposition.
Right. The ancestry kits and all the health add-on.
Exactly. And for a massive portion of the population, that data triggers immense, paralyzing anxiety.
Oh, absolutely. It's terrifying to read.
But if we can use this exact blueprint mapping genetic predispositions to create highly customized, anxiety-free preventative care plans for our dogs,
Yeah.
how far are we from applying this exact same knowledge over worry framework to ourselves?
That's a great question.
Could the objective, practical way we manage our dog's health actually teach us how to face our own human genetic data without fear?
Wow. That is an incredible way to look at it. The next time you are faced with a health screening or a list of statistical risks, maybe channel your inner veterinary expert. Check the map, empower yourself with the data, and leave the worry behind. Thank you so much for joining us on this deep dive. We love unpacking these concepts with you. Keep exploring, keep questioning, and we will catch you next time.